Hi, this is Jeff Lovett, and welcome to another edition of Around Town here on CNS TV. It's the show about what's going on in Cairo and Grady County. And this is the last week of October, and that means it's the final week for Breast Cancer Awareness Month. So today we're doing a show about that, and I'm talking to two individuals who can give us some more information, not just diagnosing and treating this disease, but also talk a little bit about some of the services that our own hospital, Grady General Hospital here in Cairo, can offer you to help in all this. So we'll first talk to Kim Gilliard, and Kim is the Radiologist Diagnostic Coordinator from Grady General Hospital. I had to read that off her badge to get it right. So we want to let people know that Grady General Hospital has a full radiology department here. Just about everything you can get in any hospital is available to us now.
We do. We offer digital mammograms 5 days a week. For the month of October, we've been offering the $20 mammograms for patients who don't have insurance or have a really high deductible.
All right, now that's been very, very popular. You guys have actually even extended hours. You extended it even a week further, but there's still only just a few appointments left.
Just got a few appointments left. We've extended hours several days during the week, and we are scheduling up till the 27th, or if the first week of November fills up. So it's filling up fast.
All right, and I know there's been a little bit of confusion about this, and some people have just walked in off the street expecting you to give them a mammogram while they wait, but that's not how it works.
That's not how it works. You do have to have a physician's order by your local physician, and we schedule the appointments.
Okay, so first call your physician or go see your physician.
Right.
Or if your physician has recommended a mammogram, like at your last checkup, just get that in writing.
Yeah, just get that physician's order and schedule your appointment.
All right, now I know a lot of people probably are watching and wondering, what is a mammogram? We have all heard horror stories about it. And so let's kind of clear that up for people that have been reticent about having one, that it's not as horrible as it's been made out in the past by some people.
It's not bad at all. It takes about 5 minutes. It's not painful. It's somewhat uncomfortable to some people, but not everyone.
Right. It doesn't matter how short, tall, big, small. I mean, you've got you can accommodate anyone.
Anyone. Mm-hmm.
You can have that done here at Grady General Hospital here in Cairo. Just make sure now if you do want the $20 mammogram that you call immediately, because there's only a few appointments left, and you guys are extended another week, but those appointments are filling up too.
They're filling up fast.
All right. So talking about Breast Cancer Awareness Month, you did want to bring in a physician to discuss this issue, because I'm sure a lot of people are not really sure if they should have a mammogram, when they should have a mammogram, etc. So we have Dr. Raina Ferenchick, who is an obstetrician gynecologist here at Cairo Medical Care, to talk to us a little bit about that. And I know that there's lots of different guidelines, Dr. Ferenchick, about when you should have it done, etc. So kind of clear that up, because even last week we had people talking about making changes to recommendations.
Sure, absolutely. And it's a little hard to clear up because it is so muddy. I personally adhere to the ACOG guidelines. ACOG guidelines recommend mammograms beginning at the age of 40 every year. The new American Cancer Society guidelines is what has really changed things up, and they are suggesting, I believe, starting mammograms at 45, yearly until 55, and then every 2 years from there on out. I think probably what you should do is talk with your physician, look at your individual risk factors. Some risk factors for breast cancer are obviously being female, starting your menses at a very young age, being obese, a strong family history, a personal history of breast cancer. So I think you have to look at each individual person and decide what is best for you.
All right. Well, you mentioned at 55, you change the schedule to every 2 years. Does that indicate that if you make it to 55 without developing breast cancer, then you don't have to worry about it anymore? Because we don't want people to misinterpret that.
That's an excellent question. And where that seems to come from is that typically, and this is not always true, but typically breast cancers that are found in women over the age of 55 tend to be more slow growing and don't progress as rapidly as those found in younger women. So that's why they've scheduled out, or they've recommended spacing out of screening.
And one of the things that I did see was the fact that they had made some suggestions on actually having physical exams at your doctor's office. Some people say that's not even necessary. I mean, what is your suggestion for people at the doctor's office and even regular physical exams at home?
Also another good question. Again, I do support an annual physical exam, especially if you have any type of risk factors, any type of family history. There's very few people out there who are in perfect health or who have a perfect family history. And again, it just comes down to looking at each person as an individual. The guidelines look at people as a whole. They don't look at what is best for an individual patient. And so that's why I think it is important to have that annual exam so you can review with your physician what is best for you.
All right, now as far as risk factors go, are there any red flags that people that make them more at risk than others?
We talked about the risk factors of the strong family history. For women, it's the early age of menstruating. And we talked about obesity. Those are the main ones. Now, signs or symptoms that you should come to your physician about would be any type of, especially bloody nipple discharge, breast pain, or feeling a palpable lump or a lump that you can touch.
And don't wait. I mean, don't wait 6 months. Do it right away.
Yeah, go ahead and, the sooner that you address something, the better your outcomes are going to be.
And with breast cancer, like all forms of cancer, I'm assuming that early detection is the best method of making sure that it's cured. And that is probably even more so with breast cancer. Is that right?
That's absolutely correct.
All right, so we do want to make sure that you are in good health, and the folks here at Cairo Medical Care and also Grady General Hospital are working together as a team to make sure that happens. And Kim, we just want to remind people before they see this video and they start calling you on the telephone that there is a procedure. So just walk us through that one more time.
Yes, there's a procedure. Get a physician's order from your physician and call and schedule your appointment.
All right, and if people have questions about their own personal case, I'm assuming that you are still taking new patients here, and you'll be glad to talk to them.
Absolutely.
So give Dr. Ferenchick a call or call the folks at Grady General Hospital. They'll be glad to help you out. Now, we, of course, want to remind you that if you have a comment about our show or if you have maybe a program that you'd like to see us feature here on Around Town, all you have to do is send us an email. You'll see an email link at the bottom of this video. So just click on that. Let us know about some event that you might be that you might be having with your church or your civic group or other group. We'd love to come cover that. And we want to thank you for watching CNS TV.